We're going to go, I guess we can go straight to Tony here now. He's on line one, and we've got a few minutes. How you doing, Tony?
Not too bad. Pete, and yourself?
Good, sir.
How's the flu? How's the cough?
Gone. I'm finally over it. I'm keeping my fingers crossed, and I'm not going to put my fingers in my mouth ever again.
No. Hard job to do.
Yep.
But, yes, I just want to touch on his personal care homes, personal and private care homes. Who's taking, like, the private partners building the homes? It's going to cost hundreds of millions of dollars that the government don't have to spend. They also got the upkeep of the place that the government don't have to attend. Now, how in God's name is that going? It's like me building a $500,000 home and putting a paper apartment in and renting for somebody for $700 or $800 a month. I mean, who's got the debt? That's the guy who builds the house. So, to me, I don't understand why that they think this is going to be worse than ever before.
Well, absolutely. The government may be relieved of the initial capital outlay, but they say in the studies by economists, professional people, in the long run, you end up paying more through these agreements. And this has been proved several times. And in the case of Ontario, if you were listening to the preamble of my first guest, $8 billion extra money was spent through P3 contracts than had the government done it on public funds.
Yeah, I'd like to see that out publicly.
That's the Auditor General's report, and they haven't disputed it, and it's clear and it's there on paper, essentially.
Yeah, because it doesn't make sense. I mean, you know, like when you got somebody building and taking care of it, hiring the staff, paying for the staff.
Well, it depends on how much you're paying them for the service over time, for various people who are availing of the service. I mean, it all adds up over time. What?
Yeah, but if government had there, say they spend say $1 billion on building these homes, I mean, how long would they have it before they get the money back? They still got to pay the staff. They still got to pay everything that's in there. They still got to upkeep of the homes.
Yeah.
So, I mean, that's something that they're not going to have. So how is it possible that they're going to be the worse off? And right now, I mean, the Liberals and the PC and everybody, even the NDP, said that there got to be another way because our health care, the way it's going, our dollars going into it, has got to change. I mean, this is open 300.
But is it fair to stretch what essentially we should be paying today for the care of people today, stretch that long into the future, another thing added to the burden of our children and their children and their children, and in the meantime, not get the level of care that we anticipate, that we expect, that we're used to, and that people require? The study I saw had some pretty clear evidence, and this is not stuff made up, that people do not live as healthily in these places, and they don't necessarily live as long as people in public institutions.
Yeah, I don't understand that.
Well, it's essentially getting less for more.
They got rules they got to follow and they got to abide by. I mean, you know, that's rules that's done up. I mean, you got to follow them. So, I mean, I don't understand. I mean, we got private home cares now, as I'm sure that's going on. The White Ball got one of them. But, you know, and the Liberals are up against this other thing. So it don't make sense to me.
I guess Danny Williams is wrong again. Then you're agreeing with Steve Kent that he's dead wrong on some things, I guess.
No, but what I like to see, I can't see how Steve Kent is coming out and saying this and they're not doing research on it, because to me, like Steve Kent and another thing of Steve Kent, I mean, I hear a lady there saying about challenges and about Steve Kent, about how Steve Kent hasn't backed down from a challenge yet. I mean, every time he's been challenged on the radio, he come on there. Every time he was questioned, he come on and answered it. Something that the man don't do is back down from anything that was challenged. So, I mean, for him to say
I think
something
she was
like that,
commenting on his use of Twitter.
But the point of the matter is, I mean, and once you talk about it, I mean, you got people in there on the other side there who can't even make a decision. They can't come out and explain anything to you. You can't say what they're going to do. They're not saying what they're going to do. I mean, they're against the home, but they're saying they're not going to spend any money to build any because we can't afford it. So what are they going to do with the 250 babies that's tied up now?
Well, you might be right about their reluctance to say what their intentions are. That doesn't mean the intentions of the current government are any more right just because the opposition won't explain their own. I agree with you that I'd be much happier if I knew exactly what their intentions were, but that doesn't necessarily excuse everything that the current government is doing either, does it?
No, it doesn't. And, I mean, this is why the questions are asked, and the answers was being given. And that's all they can do is give the answer that's been questions being asked. And they've been trying their best to do everything they can. I mean, they've been putting out money that the opposition was against because they spend money on...
I think I know your response to this, Tony, but do you think it's right late in the day of a term like this to start coming out with, significant new policies and scrunching them into the time that you fabricate, not only the time you have, but the time you manufacture for yourself by changing the rules?
Well, I mean, Paul Davis put in there. He was put in September, and since he put in there, he's done a lot. And, I mean, he's continuing to govern. Let
me ask you this. Is Danny Williams wrong about what he said about Roger Grimes, that he shouldn't do anything of any significance under the circumstances he was in, that being an unelected premier without a full mandate from the people?
You can't compare the two. You have one who's giving up away to shop in order to...
Now, was he right or wrong? Was he right to say that about Roger Grimes?
What I'm saying is this, an answer like this, is Danny Williams right there, what's his name, is going to give away Lower Churchill Falls to Quebec.
Was he right or wrong, regardless of what he was doing? Was he right in saying that he doesn't have the mandate to do anything of major significance?
No answer. At the time, Danny Williams was thinking about the best for this problem by saying, you can't give this away. You can't give this away. This is ours. And he was going to give it all. And even Roger Grimes said himself, if we couldn't afford to pay for the overruns...
I think he was pretty general. He wasn't just talking about Roger Grimes' plans with the Upper Churchill or the Lower Churchill. He was talking about doing significant things as an unelected premier late in your term.
We wouldn't be on this conversation because all this would be all done. Danny Williams had to be there, and there would be no questions asked. And his demand would be up at about 95%, like it was when he was in there. The man is.
Well, presumably, if he is a man, and I have no reason to doubt Dan Williams is not a man of his word, he would be going to the polls first before attempting these large things like reducing the number of seats and going through a massive P3 contract before the election, barely, if it's possible at all, squeezing it in just before the election. Anyway, Tony, we got to go. We're well over time.
I'm saying if he had 6 months there to do what he had to do, Danny Williams would be governor, and he'd do what's best for the problems like the PCs are doing now. And to me, when you got an opposition who is out there continuously misleading the people, who can't make a decision, who's been preaching for the last number of years about we can't spend money in health care, and meanwhile, I mean, health care, they're constantly hiring people, they're hiring nurses.
We heard that record before. Got to say goodbye, Tony. Thank you.
Yeah. But
Thank you. Talk to you again. Bye-bye.
Yeah.